According to the National Association of the Deaf, the term hearing impaired is no longer accepted. At one time, it was preferred because it was viewed as politically correct. For many people, the words deaf and hard of hearing are not negative. To be more inclusive, the person is used first, such as a student who is hard of hearing.
The legal definition of hard of hearing is a hearing impairment is a full or partial decrease in the ability to detect or understand sounds. It can range from a mild hearing loss to total deafness. In layman's terms, hard of hearing would be an individual who has lost part or all their ability to hear in either or both ears.
Hard of hearing is listed under the IDEA. It is considered a low-incidence disability. Some possible causes of hearing loss: heredity, ear infections, meningitis, trauma, certain medications, long-term exposure to loud noise, and aging. It falls into two categories: conductive and sensory neural. There's also mixed hearing loss, which is a combination of the two.
Conductive hearing loss is due to blockage or damage to the outer or middle ear. Surgery may correct these issues, whereas sensory neural hearing loss is damage to the inner ear or auditory nerve. This is more difficult to improve through technology or surgery, although people affected by this are able to hear different frequencies at different levels of intensity.
The prevalence of hearing loss reported in 2017 was identified that 2 to 3 students of every 1,000 are born with detectable hearing loss. More than 90% of these children are born to hearing parents. Approximately 15% of school-aged children ages 6 to 19 have some degree of hearing loss. Remember, not all children will be classified depending on the severity.
As a teacher, it is essential to recognize the signs of hearing loss in students. Even though children should be visiting a pediatrician, there is always the possibility of hearing loss being missed. It should be noted that hearing loss is invisible. Children with hearing loss may not even realize they aren't hearing properly. It is up to teachers and parents to be observant, educated, and aware of the signs.
It should be noted that auditory processing disorders, APD, are similar to hearing loss. APD cannot be identified in infancy, whereas hearing loss may. Parents play a key role in identifying severe hearing loss of their child in the early years. The following is a list of symptoms that parents should be aware of.
Symptoms of hearing loss would be that the child does not react to loud noises, unable to detect where sounds originated, does not respond to a name by 6 months, delayed speech or babbling by age 2, begins showing frustration and acting out aggressively at home or school, frequently asks what when spoken to.
Other areas to note in school: a child may have difficulty and/or problems with verbal directions, oral expression, interpersonal skills, language delay, rarely leads in activities, articulation, letter sound recognition, initial sound identification, syllable segmentation, and become easily frustrated, which may lead to some behavioral difficulties.
Characteristics of hard of hearing students usually is present with other cognitive impairments. This is an estimated 25% of children. What works in the classroom for one student may not work for another. The teacher should be concerned with academic achievement and speech ability. Reading is a long-term problem for hard of hearing due to language barriers.
Due to the challenges that students who are hard of hearing have, there are some facts that a teacher must know. First, be aware of seating arrangement in the classroom. The student should be able to see other students and the teacher at all times. This allows for the student to make eye contact with peers and the teacher, and in some cases allows for the student to read lips.
Second, unnecessary noise should be kept to a minimum. Students who are hard of hearing find it very difficult to concentrate when there is background noise. Blocking out some or all noise by closing doors or windows can be a simple and effective measure. Remember, even if your students use assistive hearing technology, they do not hear in the same way that their peers do. Think of implementing a UDL approach.
Third, assistive technology in the classroom is also important. A teacher should be familiar with the use of computers, interactive whiteboards, FM systems, hearing loops, and the use of closed captions to aid in understanding. Incorporating technology that augments access to learning is key.
Another area a teacher must be aware of is to speak clearly and directly to the student and not louder. If there's an American Sign Language interpreter, the teacher should communicate directly with the student at all times. Also, keep in mind the use of body language, which helps the student make sense of the context of the conversation. Again, having a seating arrangement that allows visual access to the teacher is beneficial.
Last, the use of visuals throughout the classroom is very important to improve access to language. The use of anchor charts, posters, visual fire alarms, schedules, and directions help improve access to the curriculum. It gives students additional time and structure to complete tasks, whereas speaking alone, there is no visual reference for students to rely upon.
The following are some instructional techniques. Use captions. All students benefit from captions, especially those who are deaf or hard of hearing, and those with English as a second language. The use of captions allows all students to benefit from instruction. Use it for videos, movies, or audio files that are presented in class.
Use of technology. Although some students will have hearing aids or cochlear implants, make use of various systems such as FM, hearing loop, infrared, and interactive whiteboards to complement your teaching. Assistive technology improves student outcomes, and students become more independent learners regardless of the devices used.
Use visuals. Students who are hard of hearing are visual learners and require visuals to support their learning and understanding of content and to access curriculum. Providing lesson outlines, captions, notes, directions, charts, daily schedules, and graphic organizers are a powerful way to visually organize information.
Consider classroom environment. Make sure the student is able to see your face and those of others clearly. Provide context and repetition to announce and recap what has taken place. Make sure one person speaks at a time. Use cooperative learning to keep students engaged with lessons and other students. Speak clearly and consistently, not louder or faster.
Do not assume that inattention, lack of interest, or poor academic performance is another disability such as ADHD or ASD. Hearing loss does not discriminate. A child may hear environmental sounds and speech, but unable to understand it. Screen a child's hearing if suspected. So, how would having a student that is hard of hearing change your environment?